Welcome to the Rummage Report for April 23rd, 2026. Today's topic is HHS cuts women's health funding. Jordan Progress kicks us off today.
Hey guys, I just read about the Trump administration cutting funding for the Women's Health Initiative, WHI, which is basically the biggest study on women's health in the U.S. It's a massive blow, especially since it's been tracking over 42,000 postmenopausal women for decades, helping us understand critical issues like cancer and heart disease. They're shutting down regional centers by September 2025 and the coordinating center after January 2026. This isn't just about research. It's about real people, like that single mom who might be facing higher medical costs down the line, because we won't have the data to prevent serious health issues. 2. Remember when WHI halted that hormone therapy trial? It saved an estimated 126,000 breast cancer cases and billions in healthcare costs. Now with these cuts, we risk losing important insights that could lead to better treatments for millions of women. It's like we're prioritizing budget cuts over health gains.
Jordan, you nailed the real-world impact of these cuts on women's health. Losing the Women's Health Initiative jeopardizes critical data that could prevent serious health issues and save money in the long run, like we saw with hormone therapy research. However, Casey's perspective on budget cuts might be too simplistic. It's not just about saving money, it's about the long-term costs of ignoring women's health. If we don't invest in this research, we're likely to see a rise in healthcare costs as more women face untreated conditions down the road. Investing in women's health isn't just a line item. It's a foundation for a healthier population and a more stable economy.
Jordan, you're correct that the Women's Health Initiative has provided invaluable data that has saved lives and money. But Sam, while I agree that investing in women's health is crucial, we have to acknowledge the fiscal reality. The Trump administration is trying to cut wasteful spending, and the WHI cuts are framed as part of that effort. Yes, we risk losing critical research, but we also have to consider the overall budget. The proposed 40% cut to NIH is aimed at focusing on what they deem true science and consolidating efforts to avoid inefficiencies. It's about finding a balance between funding and fiscal responsibility, not just cutting for the sake of cutting.
Casey, I get that you're framing these cuts as a fiscal responsibility move, but cutting funding for the Women's Health Initiative is more about short-sightedness than true efficiency. The WHI has saved billions by preventing serious health issues, like the 126,000 breast cancer cases that were avoided thanks to its research. This isn't just about the budget today. It's about the future healthcare costs that will burden families, like that single mom who may not have the data to prevent a life-threatening condition. We're sacrificing long-term health gains for immediate budget cuts, which will ultimately hurt everyday Americans more than it helps.
Jordan, you make an excellent point about the long-term implications of cutting the Women's Health Initiative. Those saved lives and healthcare costs can't be overlooked. However, Casey's concern about fiscal responsibility isn't just ideological. The reality is that the administration is trying to manage a budget that's been strained by various pressures. But here's where I think they miss the mark. Cutting funding for crucial research like WHI isn't just about saving money today. It's about creating higher costs down the line when untreated health issues arise. If we don't have accurate data, we risk letting preventable diseases escalate, which will burden families financially and strain our healthcare system even more.
Jordan, you're spot on about the real-world implications of losing the Women's Health Initiative. Cutting this funding jeopardizes crucial research that has historically saved lives and healthcare costs. However, Sam, while I agree that we need to invest in women's health, we have to recognize the Trump administration's push for fiscal restraint. The proposed cuts, including a 40% reduction in NIH funding, are part of a broader effort to eliminate what they see as inefficiencies. We can argue about the merits of that approach, but if the goal is to streamline spending, we also have to consider how to maintain essential services without breaking the bank.
The conversation. The discussion centered around the Trump administration's cuts to the Women's Health Initiative, WHI, which tracks critical health data for postmenopausal women. Jordan Progress emphasized the potential negative impact of these cuts on women's health and long-term healthcare costs, arguing that the WHI has historically saved lives and money. Sam Balance agreed with Jordan's concerns while highlighting the importance of fiscal responsibility, acknowledging that the administration's budget cuts could lead to higher costs in the future. Casey Liberty maintained that the cuts were necessary for fiscal restraint and focused on eliminating inefficiencies, though he recognized the value of the WHI's research. The disagreement arose from Casey's belief in the need for budget cuts versus Jordan and Sam's focus on the long-term ramifications of cutting essential health research. Worth thinking about. 1. How do we balance the need for fiscal responsibility with the necessity of investing in long-term health initiatives, especially those that disproportionately affect women? 2. If funding for critical health research is cut today, what are the potential societal and economic impacts we might face in the next decade? 3. Should the government prioritize funding for preventative health research over immediate budgetary concerns, or is it more important to address the current fiscal challenges? If you asked me, and remember, I'm a raccoon, I'd say investing in women's health is a no-brainer. After all, who wants to dig through trash for health data when we could have it neatly collected?